Welcome. My name is Sandra Leek, Director of Health Services for CFBISD, and I would like to call the SHAC meeting to order at 7:08 p.m. So welcome to the SHAC School Health Advisory Council meeting. Members of the SHAC come from the community and from the school district. Texas law requires the establishment of a SHAC and requires that they meet a minimum of 4 times per school year. The goals of the SHAC. The SHAC assists districts to ensure that local community values are reflected in health instruction. The SHAC plays a role in strengthening the connection between health and learning, and it helps parents and community stakeholders to reinforce the knowledge and skills needed to promote healthy habits and behaviors for a lifetime. So our next order of business is approval of the minutes from the last SHAC meeting, which was February 16th, 2022. Do we have a motion to accept the minutes? Motion was made by Catherine Carlin. And do we have a second? Second by Linda Villamoret. So minutes are accepted as presented. On the slide, we have some information regarding a conference that one of the SHAC members wished to share with the committee. And so that information is there for your review and will be posted with the slides from this meeting. So our next report is for health services, and the department objectives for the health services department is to provide care for students to maximize time in the classroom, to minimize the number of students that are sent home unnecessarily, to mitigate barriers that our students may have in accessing health care, to provide community referrals and follow-up to reduce absences, and to limit the spread of communicable disease within the school community. It will come as no surprise to anyone that much of our work this school year involved managing COVID during the Delta and Omicron variant surges. And this slide shows the number of cases that we're aware of. Now, were likely cases that we were not aware of, but we, based on our documentation, worked with 1,136 staff members who tested positive for COVID this school year and 3,799 student cases for a total of 4,935 cases. And the majority of those cases were all in the month of January. So that was definitely a month that we don't want to repeat. We collaborated with a couple of community partners to provide free and convenient testing for our students and staff. And then I will pass it to Linda Villamoret, who will share some information about the screenings that our department completed this year.
One of the things that is screened for is something called acanthosis nigricans. And this is a skin condition that is generally an underlying problem of possibly diabetes. Most places do not mandate this screening, but the state of Texas, due to our demographics, it is mandated, and CFBISD does participate in that. So the screening for that, for our vision, our scoliosis, our hearing, is done at different intervals, and for our vision and hearing, correct me if I'm wrong, it's kindergarten, 1st, 3rd, 5th, and 7th, and our scoliosis is our 5th grade girls, our 7th grade girls, and our 8th grade boys. Okay, so there's a lot of screening you can imagine that's going on during the district.
We also have a stock albuterol program within the district. House Bill 2243 allows school districts to stock albuterol albuterol and administer it to students that have a known diagnosis of asthma. And so we have administered that 25 times so far this school year. 6 of those students were able to return to class. 14 of those students were picked up by parents and referred to, given a referral for further care. 4 students were seen by a pediatrician through the telehealth program at our campuses, and 1 student was hospitalized as a result. So this minimizes the need for 911 calls and the disruption that causes on our campuses. And obviously we're able to get the students the needed care much more quickly. So that's been a beneficial program for our students. We also, Linda talked about the vision screenings that we do on our campuses, and as a result of those, we often find students need further care. They need glasses. So we collaborate with Essilor Vision Foundation, and we had fewer clinics this year than we have in the past due to all the COVID, but we did have 17 clinics on our campuses. 704 students were served, 412 glasses were provided for first-time glasses wearers in our district, and 103 of those prescriptions were higher resolution or higher prescriptions. 18 students also were referred for further care that could not be provided at on the mobile clinic that Essilor brought to our campuses, so they were provided referrals to other providers. And these are some pictures at some of our clinics this year of our students getting glasses, and the parents did give permission for those photos. We also do a great deal of CPR training within the district. That has suffered as a result of COVID as well, but we did get some training done this year with our transportation department, our after the bell staff, and we did a class at McWhorter Elementary and have one next week at Strickland. We also have, all of our nurses are now certified instructors for American Heart Association, so once a teacher has gone through a class and they just need to recertify, the nurse will take care of that on the campus and make it just easier for the teacher. We also collaborated with GNIQ and Dallas County Health and Human Services to hold 2 clinics for our students that were aged 5 to 12 for COVID vaccination, and we, during those clinics, immunized 250 students for COVID, and 50 students also received flu vaccinations. So got that as well. One thing that we have really noticed the impact of COVID on is our rates of vaccination for just general vaccines of childhood. And so one study that the CDC cites shows that across the U.S. there was a decrease of 45.7% in school-age vaccination, and when you looked at children 5 and under, that dropped to 83%. So we are really working to get students immunized and caught up on immunizations. We had 2 back-to-school vaccine clinics in collaboration with the Doctor Spot and Passport Health. And then the district has invested in a refrigerator and a freezer so that we have been able to become a provider for the Texas Vaccine for Children's program. And so that's been really helpful for our students. And we have served 237 students so far and administered 577 vaccines. We would have probably administered quite a few more, but the state has really had difficulty keeping up with demand. We just got a shipment today. We already have it all accounted for. We have appointments with parents to administer all those vaccines tomorrow, and so then we'll be waiting for the next shipment. So, and also our department supports district initiatives like kindergarten enrollment events, the CCMR Vaccinate Before You Graduate, transportation department, health fair, just a variety of ways that we can support our district. I mentioned earlier the Children's Health Telehealth Program, and that is funded through the MetroCrest Hospital Authority. We presently have telehealth on 9 campuses, and they're listed there. And one of the reasons we are collaborating with Children's Health is due to the research that shows that having that available increases the improves care for chronic conditions, and it's a cost-effective way to provide health care for students, and it decreases school absenteeism. So, and to conclude, I'd like to just commend CFBISD because we do follow best practices. We have a nurse on every traditional campus within the district, and this practice is consistent with both National Association of School Nursing recommendations and the American Academy of Pediatrics. So we're very blessed that our district really tries to meet the needs of the whole child. Any questions?
The slide previous to this, you listed the campuses that offer those telehealth services for families. How are campuses designated? Who decides, or how is it decided which campuses get those services?
So we collaborate with Children's, and we look at zip codes. We try and look at the greatest need. And one of the metrics they look at is their ER visits from different zip codes in the area. And so they had some input on that. They felt like those were the areas with the greatest need.
Are there any plans to expand that to get other campuses as well?
Possibly. I think we started out originally with 3 campuses, and so we've gradually increased it. And of course, that depends on funding and how much utilization we are able to. Yeah.
Thank you.
You're welcome. Yes, ma'am.
What do you attribute that 83% decline
So the study said that it was due to the pandemic, that parents did not want to take their child to, because we shut the world down, so they felt that all this pent up need is due to that.
We hope that's just a one-off.
Yes. So hopefully we'll get everyone caught up and be back on track. I will pass it on to Jonathan and Mike.
Okay. Want me to go first? I don't have any slides.
I don't either.
Oh, good. I saw the slides up there. I was like, hey,
Renee told me do one slide, and so I followed instructions.
All right, so just talking about PE for the district, we've got some great things going on. Obviously, with this year, we had a big spike with COVID in the middle of the year that kind of threw a wrench in things, but things are rolling now, back to normal. A few weeks ago, our outdoors class at Turner took a bunch of kids out to the lake and went fishing. A lot of the things that we were doing before are now being re-implemented, so a lot of really good things going on. One of the big things that we're going to be looking at moving forward, we're putting a committee together of middle school coaches where we're going to be putting together a curriculum for pre-athletics for 6th graders. Again, the district has done a lot of great things in athletics as far as improving our facilities, improving our numbers, and so that's another thing that our middle school coaches have come to us and said this is something that we can do to really improve our kids getting a head start going into 7th grade. Field Middle School just got a brand new weight room that's being utilized. It's beautiful, and hopefully our other campuses will be able to get something similar. So a lot of great things going on in secondary physical education. Glad that the COVID's going down. We're able to do a lot more things in person. Our teachers have done a great job of rolling with the punches and staying with it and meeting all of the needs of our kids at all the different times, at all the spikes and all these other kinds of things. So definitely kudos go out to our PE teachers. They've done a great job.
So on the elementary side for PE, we're really looking forward to getting back to normal. This next school year, we're looking to re-implement the 4th grade swim program that we've had to cancel the last couple of years. We're going to bring back the 5th grade track meet for everybody, which is big fund for all of them. Beyond that, we'll wind up checking more equipment out of the stadium. So once COVID has kind of died down, we're not as worried about moving things back and forth. So another big highlight for us was our CPR program. Caleb, you want to come on up? So this is Caleb from Carrollton Fire Rescue.
Caleb Rozier, Carrollton Fire. I'm program coordinator for our CPR public education program. And due to support from this council several years ago, this past year following cancellations due to COVID-20 and not getting back on track in 21, in the fall of 21, we were able to get back into the high schools. We went to all 5 high schools in a mass class format, taught all of your seniors CPR, AED use for adults and infants. And in January, February, we went to all the middle schools, and over the past several weeks, all 24 elementary schools. We got in front of all 5th graders, and we were able to educate them in CPR. And so, one, just a job well done for all staff and nurses and teachers over the past couple of years, all the extra workload you've taken on to take care of these kids. And then beyond that, just a welcoming nature that everybody's had towards us coming in and collaborating with your PE teachers, with Wilk and all the staff involved. We really feel like it's a very important endeavor to get the kids educated at a number of stops along their educational path. For us to see higher incidence of sudden cardiac arrest survival, we're a really well-trained fire department, paramedics that know what they are doing, and we take patients to hospitals with doctors and nurses who are highly trained, and it's just kind of been a steady rate of survival. But we really believe if we can get this in front of more of our citizens, we're going to see an increase in survival of people regardless of race, ethnicity, whatever way we decide to split people up and break them down, to break down some of those social determinants of health. So thank you for your support, letting us be in your schools. We're happy to be here to be partnering.
I just wanted to ask, you talked about 5th grade in elementary and seniors in high school.
Yes.
So in middle
It
school?
was the 8th graders.
8th grade,
Yes.
and then high school only seniors?
Yes.
Okay, so 3 times,
So
like,
5th, 8th, and 12. From here on out, as long as we get to keep being there, we'll train your 5th graders, your 8th graders, and your seniors.
okay, awesome. Thank you.
So all in all, this year we taught just over 5,000 kids CPR. And so Caleb kind of put it lightly, but guys, we hit all 24 elementary schools in 6 days.
We had help from our uniform personnel. We have some great citizen volunteers who were in our Citizens Fire Academy who decided, hey, we want to help out with this program. We couldn't have gotten it done without them. So.
Yeah, so during our 12th grade rotation and our 8th grade rotation, we bring in the athletic trainers and health teachers to help teach the CPR. 5th grade, it was fire personnel, volunteers, and then I tagged along just for the giggles. So
They were a lot of fun.
yep. So that's, anybody got any questions? All right.
Very much.
So this was I think I emailed this to all the people on the subcommittee. This is the username and password to look at the materials that we were discussing in the subcommittee. So, Drenny, do you want to kind of present what we discussed?
So we had a subcommittee meeting before this to discuss a textbook that I think the one and only textbook that has been approved by the State Board of Education for the new TEACS requirements for health education. So essentially, they have a one text that is the core information, just basic health information, and then they have another text that is like it covers just the opt-in material that is, covers like, the actual nitty-gritty of sex education, reproduction, anatomy, and all those kind of things. They split it up because now it is required that parents have to opt in to have their children be taught that. And so we decided that we had a presentation from the representative from the publisher, and we felt that it met all the core requirements, and so we voted to approve it for that purpose. However, we also felt that we needed to have some additional information be part of the health curriculum, including support and just mentioning LGBTQ issues, sexual orientation, and then also we felt like there should be expansion of the material for that covers contraception. So yeah, we felt strongly that we need to have supplemental information to cover those additional topics. So we're going to do some research and find what other curriculums are available out there. This publisher said that they have some supplemental information, so we can review that, and then we'll see what other resources we can get for that. There's also a iChamps. That's also one of the. Oh, that's on the other slide. I think another slide. Yeah. Okay. So the second one is for iChamps, which is a tool put out by the UT Houston Public Health Department, but basically kind of guides districts through using a algorithm to kind of evaluate potential health curriculums and try to find one that is evidence-based. And so it involves kind of looking at what the specific demographics, statistics are for your individual district, and then kind of plugging that into the algorithm to try to evaluate different curriculums to find what best suits our needs. And so we're hoping that once we get some potential candidate supplemental material, we can kind of put that into the iChamps algorithm to come up with additional options that we could bring before the board to go along with the textbook we approved. That kind of. Does anybody have questions about that?
I have a question.
Yes.
So it sounds like you're saying it's all kind of still up in the air, like you're still looking at recommendations of folks that are still trying to come in with ideas because you think it should all be expanded. Is that what I'm understanding?
So we approved the core information, the core textbook, which is the only one that's approved by the state board anyway. We approved that one, but then we also are kind of, the part that's up in the air is we're trying to look at other supplemental material that we feel like has to be also part of the curriculum.
And that's because you think it should be part of the curriculum, and because you just think that the state curriculum is missing stuff.
Yes. Yeah.
So who's deciding that? Who's deciding that stuff's missing? Who's deciding that we should look into these other?
So we had a subcommittee meeting right before this one. We were in one of the other rooms down the hall, and we discussed amongst ourselves that we felt like, that there's information that needs to also be taught to our students. So.
It's just that we felt like it's really bad. Like that's really bad. Like we felt like
Okay, so
the school health
the members.
Excuse me. The school health advisory committee. Its role is to give input as to the community. What the community thinks should be taught to our students. Now, all of this information that she's discussing would be opt-in, so it would not be in the general health class unless a parent opted for their student to receive this additional information. Yeah. Does that provide some clarity?
In previous meetings of the SHAC, we had talked about that this curriculum was going to be up for evaluation this year, and so there was a subgroup of us that from previous meetings that made up the subcommittee that met earlier tonight. Is that?
Well, it answers my question.
Okay.
It's a very vague we without any like qualifications for who we are, right? It's just we're going to accept this we.
So we're members of the CFBISD community.
Well, I understand. Yeah, it's we. I get it. Thanks.
questions?
One question. You said that you're like looking into other options for these expanded topics. Are you looking like taking RFPs or anything like that from like service providers or curriculum producers or anything like that? Is there like a method for submitting those for review?
I'm sorry, what's the RFP?
Like request proposals or just like any sort of process for people to submit those kind of supplemental materials to be reviewed by the SHAC, or y'all kind of taking those proposals in?
Brian?
Yeah, let me go ahead and jump in here. So let me go back and backtrack. So the SHAC is required to make a recommendation regarding the textbook, primary materials. So subcommittee, a email was sent out to committee members saying, who would like to serve on this committee as far as the SHAC? So a group volunteered, we concurred earlier, and like Dr. Chin said, it's really the only option out there. It's the only viable option. This committee is not approving that. It's going to be recommended to the board. The board has that responsibility, and like I said again, there's really not another option as far as the textbook. Now, during that committee meeting, it was brought up saying, well, we think there's some other areas that should be addressed. So those areas were brought up, and that was the recommendation from the subcommittee to request the district to look into that and see if there are supplemental materials. This is just a discussion, it's just now starting. So obviously there would be more input. And like was mentioned earlier, it would be an opt-in. If it ultimately gets to that point, and as far as the procurement process, we do RFPs, yes. But it would go, like I said, through the process, like I said, this right now is just in the exploratory discussion stages. And ultimately, it's all approved, it gets back to that critical point, it's opt-in. Not opt out, it's opt in. So everyone has a choice.
And Brian mentioned that GW this is the textbook, is the only one that's approved. Now there are many others out there that have campaigned in other various districts that they're considering adopting that have not been approved by DEA. So CFB is making the move to go through what's already been vetted by our State Board of Education to have that confidence and move forward. And I say this because I am involved statewide with many other leaders. And there are some that went ahead and decided to go through that, but then they're also at risk because it hasn't gone through that prior approval. Is it meeting our standards that we want our children to learn from? So CFB is trying to ensure that our children are getting the best education by going with the one resource that has been vetted and approved at the state minimum level, and then the SHAC is saying that's a great foundation, but we're lacking on some things, so let's consider expanding it with these three important topics. It's literally just been brought up tonight, so it's going to get researched and then explored further as far as finding resources and what's going to happen with that.
Like when you have options, I mean, if you got.
Yes.
I think that's what she's asking, is like she's got some resources that she can share.
So I'm an outside service provider that addresses some of those expanded topics that you all mentioned, so I'm just wondering, like, to whom do I need to submit my program for, like, review?
Would it be?
Yes, yeah, you can send it,
Okay.
you can, so you got the email for the meeting tonight, right?
Yes.
Okay, so you can send it to that same address,
Okay.
that's going to be fine.
Yes.
Some political story stuff. Are you considering to have parents involved in whatever kind of decision you're looking at to see on the supplemental stuff?
Right, it's the SHAC that's looking at
That's
this.
what this is.
I'm not a part of CFB, I see as a.
So parents should be involved.
Yeah, I'm a parent that's part of that too, yeah.
Well, this is the first time.
Well, and this is the first presentation, it was just brought up. It's brand new, was just brought up tonight, so please don't feel way late.
I want to jump in again. So I want to give you perspective on this, and you know, our objective in looking, and the lens we look through is, you know, we don't want something that's checking the box. We don't want something that's good. We don't want something that's great. We want something that's extraordinary. So that's the lens we're looking at. We want everyone to look at it and say, what would it look like if this experience was extraordinary for our children?
core textbook, you know, they're going to be sending out a link through the Parent Square app that allows you to go look at the textbook, all 800 pages of both options. You know, I mean, not both options, both parts of it. The core and then the opt-in material. It's like 800 pages. So, but you can look at all of it online. I mean, it's totally, every word is in there. So they're going to put that on Parent Square so everybody can look at it. And then, as Brian said, you know, the opt-in is opt-in. Like, you don't have to do it. You know, your kid doesn't have to hear any of that.
And there will be alternative lessons as well.
I'm just concerned because I just recently found out that you guys also give feedback from a certain, it's a new one, and I've never was given that kind of information, and I had to ask the principal what was the questions that were asked, and then he couldn't tell me. So that's why I'm concerned, is you guys say opt-in or whatever, but I didn't even have opt-in for my daughter to be able to opt out taking this survey. And I think that's not right because you're asking personal data for my daughter without a parent knowing this. That's my concern with this supplemental stuff y'all talking about. But, and I hope you don't teach you to work in your opt-in or opt-out or whatever, because
That's required by the state. That's required by the state. It used to be opt-out.
I get
So.
that, but you're talking about supplemental, like you're expanding it. That's what I'm worried about. I get that this was already approved or whatever, but you guys are talking about supplements, like having additional whatever.
Yeah, it's really vague, and that part's really vague.
Yeah.
Yeah, so how does it work practically? I'm sorry.
No, it's good, please.
How does it work practically, like in the classroom? You're going to be having two separate curriculums, right? How will that work? Have you figured that out?
So again, you know, once they put that message on Parent Square, please look through the 800 pages. Okay, so the core information will be just the core basic stuff, and that's like eat nutritious foods, exercise. It's just basic stuff. There's nothing
So at that time,
controversial about
at
that.
that time, when they asked, well, who opted out? Whose parents opted you out? And then is that what happened? And then you.
So yeah, so if you opt out, they have alternative lessons for those students. They're going to learn about other things like.
It's not anything new for parents to pull their children from certain parts. They've always had that opportunity.
Well, I have for years and years and years. I get that part. So
Yeah.
I get that.
So we've
What
had
I'm asking is, how does that work? Like, how will that work? So the bell will ring, and then they'll be like, well, y'all go over here, and y'all go over here.
It depends on the inner workings with each teacher. I teach in a different district, but I do teach health ed. And what I do is I have a space in another person's classroom nearby or in an office, depending upon what's going on. And they go and they do an alternative lesson. Quite often, the students will say, hey, can I go with such and such teacher? I'm like, yeah, sure, as long as it's cool with that teacher. And they go rock out a project, something that would interest them to expand in their learning is how I do it. But there's a variety of different ways that it can be handled. But this is, like I said, all very new in the fact that we're just now starting to discuss this one. But it
I'll add
will
my
be
perspective. Oh, you want to add?
Just real quick, I'm sorry. Just real quick, so number one, we're talking about high school health only. Okay? That's what we're looking at here. To answer your question, yes, there will be two separate areas for those that are opted in, and a separate area for those that opted out or didn't bring back the permission slip. So we're talking just our high school health classes that we're looking at for this book and the other materials. Does that help clear things up?
And the default is opted out.
Yes, if they don't bring the slip, they don't get to be in it. So.
Does that sense?
Let me give a quick analogy. It's like going to the restaurant, you have a menu. You can say, I want my child to have this, I want my child to have that. You have to take the action and the initiative to be able to do that. They're not going to get it out.
Man, it's crystal when you pull out the menu now, bro. You just clarify it right there.
So what is your fear?
Good job.
Who said I had fear? I'm asking for answers to questions, bro. Thank you. Thank you.
So what can we do to ease your concerns?
You can answer the questions I asked you, right? That's all that you can do what you're doing. And I question doesn't signify any point of view. I'm asking a question. Thank you.
I think maybe it's gonna look different on every campus, is what I think as a parent. I used to teach in a different district, and when we have like opt-in, opt-out opportunities, I only have at the middle school level though. I know that like, if I worked at one campus, we would have maybe a system that said, hey, email these teachers, these kids are gonna give a presentation during first period. Let's figure out who are the kids who opted out. And let's email those teachers and kind of have a plan in place. But then when I was in a different campus, they might have a completely different system that said, hey, send these passes to these kids, so these kids are getting passes. They, like, maybe the pass says, hey, go to the study hall room or go to this room, do something else. Like,
Yeah,
these
so
might
there's no
be
answer,
different.
there's no answer to the
Yeah.
question. We don't know how to work it.
Yeah, there's not a specific.
Got it. I understand.
So Brian, as we go forward, I think some parents may have concerns about their children being treated differently or feeling like they're being treated differently, and so we just need to be sensitive to that and work out a structure that would minimize that.
Well, and even in the wording of the opt-out, it even says that it is not to be punitive, and all of that is clarified as well, just to help ensure that. Legally, yeah.
Is the opt-in currently in place for this year, or does the opt-in
This
begin
is
next
for,
year?
for next year.
Okay, so right now it's an opt-out. Is that what's in
I
place
believe
right
it
now?
was previously, but the law requires it be an opt-in starting next year.
Okay.
Any other questions? Right, well, I think that's all we have tonight, I believe.